Yeah, now we start with the DAMS International Grey Matter Quiz Season 1 by Dr. Sethi sir.
Anji, everyone, warm welcome to all of you. And I wanted to, give you the background behind this quiz. And we have kept the quiz very interesting for you. Don't worry and don't panic. And I want all of you to calm your nerves. एक बार relax रहेंगे. कुछ ऐसा hi-fi नहीं करेंगे. But the reason we started this international edition of DAMS Grey Matter is because I thought कि हमारे पास बहुत सारे we have a lot of students from India who are participating in the Grey Matter since I think last 2 decades now. मतलब पिछले 20 साल से हम ग्रे मैटर करते हैं, जो इंडिया के बड़े बड़े कॉलेज से बच्चे इसके अंदर हमारे साथ पार्टिसिपेट भी करते हैं. And every year people who win in the DAMS Grey Matter, they end up getting top ranks in NEET PG and AIIMS exams also, AIIMS exam also. So this year I thought, why we are not doing it for the foreign medical graduates also? Can we somehow make a method where we can, encourage you? मैं चाहता हूं कि ऐसा ना हो ना आप लोग को ये ना लगे ना कि कहीं हम खाली FMGE एग्जाम की तैयारी कर रहे हैं या ऐसा कुछ नहीं. मुझे तो ये लगता है आप लोग बहुत कुछ कर सकते हैं. एंड दैट इज माय आइडिया कि टुडे आप हारें या जीतें वो मैटर नहीं करता, लेकिन आप वापस कॉन्फिडेंस लेके जाओगे कि आप यहाँ तक पहुंचे. A lot of students participated in this preliminary round and you are now in the final. I want to first of all congratulate you and I am very excited for this event. So these are the 6 teams that we have today. 2 teams from Kyrgyzstan, 1 from Armenia and Kazakhstan, 1 from Philippines, 1 from Russia, and 1 from Ukraine. And what we'll do is this quiz will have 4 rounds. And what we have tried our best is that we have tried to keep the questions in the pattern of the FMGE exam. So जो आप questions देखोगे ये हमने मुश्किल रखने की जगह we have tried to keep it at the exact pattern of the foreign medical graduate screening exam. So if you are doing well right now, you should get the confidence कि आपका डायरेक्शन ठीक जा रहा है. अगर आप आज अच्छा नहीं करते तो भी घबराना नहीं, सीख तो रहे हैं ना. ओके, सो टेक इट एज अ लर्निंग अपॉर्चुनिटी. पहले राउंड के अंदर टोटल 6 क्वेश्चंस होंगे. ईच टीम विल गेट 1 क्वेश्चन. देयर इज नो नेगेटिव मार्किंग. Maximum of 60 seconds. If you answer it correctly at one go, plus 10. And the quiz master's decision will be final. Are you ready? Okay. So I will request now the team A to keep the screen open. Team A. Only two bachas, Prashasti and Bhavika, to keep the screen open. Shabash. So you keep, you can unmute your mic and rest of the teams can, they make their mics mute. Okay, so my first question for team A will now be shown on the screen. Are you ready? Yes. Okay. You have to identify the marked canal or foramen in the image. Okay. Your time starts now. Are you thinking together?
Yes, sir.
Yes.
Bhavika,
what I think is, I think it
is foramen.
Yeah, it is definitely a foramen.
Yeah, it is a foramen.
Sir, I think it is foramen rotundum, sir.
And,
rotundum.
Is it final? Shall I take it as your final answer?
Bhavika, please. You also.
Lock कर दिया जाए?
Bhavika, what is your point of view, please?
Yes, sir.
Okay. So both of them are saying lock कर दिया जाए. They are saying it is foramen rotundum. And their answer is absolutely correct. Well done. You get plus 10 marks. Well done. Well done. Super excited. थोड़ा सा घबरा रहे थे लेकिन आंसर ठीक था. Well done. Well done. So now we go to the team B. Now Bhavika and Prashasti, beta, I'll request you to switch off your cameras. And the team B, the students from team B, I'll just name them also, just to be Samrudhi from Philippines, Samrudhi and Mahbul. Okay, are you there, beta?
Yes, sir.
Okay. So I will show you your question and then we will have the time to answer it. Okay, ready? Okay. 20-year-old man comes to a physician because of progressive muscle cramps. intolerance to exercise during the past 3 months. On one occasion, he passed burgundy-colored urine. His serum lactate concentration does not increase in the blood from vein proximal to exercised forearm. Biopsy of the muscle shows increased concentration of glycogen. Which of the following enzymes is more? You have to name the enzyme. There's no choice given. So which enzyme is most likely to be deficient in the patient's muscle? So theme for the round 1 by now you must have guessed is going to be basic sciences. Okay. Anyone? Are you ready, beta? You understand the question? Muscle cramps है, intolerance to exercise है, burgundy colored urine है और उसमें lactate नहीं बढ़ रहा proximal जब हम vein में sample देखते हैं और biopsy पे muscle के अंदर glycogen बढ़ गया. Okay. Enough clues दे दिए मैंने. Your time is ongoing. आपस में discuss कर सकते हो आप. Are you discussing? Please nod your head to let us know. Are you thinking?
Sir.
Google तो नहीं कर रहे बीच में तुम? You just need to name the enzyme which is deficient in this condition. How much time is left?
Sir,
Glucose 6-phosphatase.
the time is up now.
Okay, what is your final answer, beta?
Glucose 6-phosphatase.
They are saying the answer is glucose 6-phosphatase, which is not correct, and we cannot give you any marks here. Any idea, Samriddhi? आप बोल नहीं पाए. Samriddhi, you want to give any answer?
No, sir.
Okay. So anybody else from the teams who wants to give an answer right now, you can just put on your camera and answer. अभी marks तो नहीं मिलेंगे, लेकिन just.
Can I?
Lactate dehydrogenase.
Yes, Priyanka, what are you saying?
Muscle phosphorylase, sir.
So,
Is it glycogen phosphorylase?
Yes, Priyanka, and I think both of you are right, but we cannot give you any marks. The answer was glycogen phosphorylase. Well done. So I think now at least confidence आएगा कि हम अच्छे कर रहे हैं. Samriddhi, don't lose heart. अभी बहुत बड़ा quiz बचा हुआ है. So I will request Samriddhi also to switch off your camera now, so that the team C, the students from team C can put on their camera. Team C and team C from Russia, Vijit and Megha, and the single camera. They are directly together only. So not much problem here. We can just directly show you your question. Are you ready for the question from basic sciences? Here is your question. 51-year-old woman presents to hospital OPD complaining of fatigue. There is no history of fever, vomiting, diarrhea, but physical examination shows dry mucous membrane, BP 90/60. Lab studies show plasma sodium of 129, plasma potassium 5.5. Which is the likely cause for her hyponatremia? सोडियम कम है, उसका कॉज बताना है, पोटेशियम बताया हुआ है, बीपी बताया हुआ है और फटीग की कंप्लेंट.
एडिशनल क्राइसिस भी लग रहा है, बीपी भी कम है, प्लाज्मा सोडियम भी ज्यादा है, पोटेशियम 5.5 है, हाइपोनेट्रिया में है. मेरे को लगता है एडिशनल क्राइसिस हो रहा है इसको और 42 के लिए.
Yes, Vache, what is your final answer?
Diarrhea. Sir, most likely cause for the hyponatremia will be diarrhea, loss of fluids.
Will be, can you be louder?
Will be diarrhea, sir, loss
time
of fluids.
Yes, but why is the BP is given to you? There's no fever, no vomiting, no diarrhea. Can you now see? So there's no history of fever, no vomiting, no diarrhea, but there is dry mucous membrane. Now, can you think of it? You were on the right track, but I think somewhere you are confusing. Time is up, so give your final answer, beta.
Addisonian crisis, sir.
So they are saying the final answer is Addisonian's crisis, and let us, and I'm sure they are correct. The correct answer is Addison's disease. I'm giving them plus 10 marks. Well done, beta. Well done. Awesome. So, already we can see that there is a lot of talent in the foreign medical graduates. Sometimes, I keep seeing, people might think ये बच्चे कम पढ़ रहे हैं या ज्यादा पढ़ रहे हैं, ऐसा कुछ नहीं है, बच्चे बहुत मेहनत कर रहे हैं. दिस इज द वे वी वांट टू ब्रिंग फॉरवर्ड द फॉरेन मेडिकल ग्रेजुएट्स विद सच एकेडमिक इवेंट्स. So I'm very, very proud of you, beta. And the next question is for team D. I would request Vijit and Megha to switch off the camera, and team from Ukraine, Priyanka and Hitesh, to put on the cameras. Okay. And because you are so intelligent, I will give you a tough question only. Okay. Ready? Okay. I am bringing your question. Okay. Hitesh कह रहा है प्रियंका ने मरवा दिया पिछले में आंसर करके, बट क्या करे, आना पड़ेगा. Ready? Okay. During anatomy dissection, a first-year medical student is dissecting the atrial chambers of the heart. At the upper border of fossa ovalis, she discovers a small opening through which the tip of her probe can be passed from right to left atrium. Laboratory instructor identified this as probe patency of the atrial septum. This probe patency resulted from which developmental events? You need to tell us why there is a patency for the probe in this particular case. You want to discuss? You can discuss amongst yourself. Okay, done?
Sir, time up.
Yeah, you can discuss. Anything you want to answer? Nothing. So anybody else in the team, participating teams, wants to answer anything, or the audience who are listening to us on YouTube, if you want to answer, please fire the chat box and let us know. Anybody in the participants who has an answer? You can just switch on your camera and answer. So what is the problem? Why it has happened? What is the failure of events? Anybody?
So it is atrial septal defect.
So the reason this is happening is because there is a failure of fusion of septum primum and septum secundum. That is the reason that we wanted to get from you in the question. So next question is directly for the team E. Team E, we have students from Armenia, Dr. Nandini, and student from SKMA, Kazakhstan, Dr. Bhavna. So Dr. Bhavna and Bhavna, I'll request you to put on your camera if you are able to do it. Yes, perfect. So that you can, directly get the direct question from me. Please unmute your mic so that directly you can answer. Ready? Okay. 50-year-old male presented with symptoms of fatigue and has swelling of feet and loss of sensation in the legs with anemia also. He has dilatation of ventricles, high cardiac output state. Which vitamin deficiency is responsible for the presentation? High output cardiac failure, dilatation of ventricles, loss of sensation in the legs, anemia. Which vitamin deficiency can lead to all this?
Sir, vitamin B12.
Yes, sir.
Can you discuss amongst each other?
Nandini, is it right?
I also think so. It is vitamin B12 deficiency, sir.
Okay, they both think it is B12. Shall I lock the answer? But are you sure?
Yes.
Okay, so I'm locking the answer, and unfortunately the answer that they're saying is not correct. Let me ask any other team members who wants to answer, or anybody in the audience wants to answer. Anybody who wants to answer can just switch on the camera and answer.
B6, sir.
Vitamin B6.
Vitamin D, sir.
B6, sir.
Actually, the correct vitamin is vitamin B1. Correct answer is vitamin B1 or thiamine, which is leading to
B1.
such a state.
B1.
But so we will not be able to give the marks to any of the teams. So the final question for this round of basic sciences is for the team F from Kyrgyzstan, Prince and Osama. Please put on your cameras so that I can ask you the direct question of this round. Are you ready?
Yes,
Done?
sir.
Okay.
Yes.
Your question is this. A 17-year-old patient suffering from type 1 diabetes is non-compliant with his required insulin therapy, develops hyperglycemia after eating chocolate. Release of which of the following intestinal hormones will be most likely stimulated?
Friends, on करो.
ओके बताता हूँ.
Glucagon. Friends.
Diabetes, non-compliant with his insulin, has hyperglycemia. Which of the following intestinal hormones will be stimulated?
फोन आपके पास है मेरा? सोना भैया.
Friends, NBS.
Time up, sir.
Sir, Glucagon, sir.
Glucagon.
Time up.
Here goes.
So unfortunately the time is up. So any answers you want to give?
Sir, Glucagon, I said.
Glucagon.
Yes.
Okay. Unfortunately, that is not correct. So, any other team members wants to answer?
Sir, glucagon like peptide.
Maybe dopamine.
GIP.
GIP.
Who is saying GIP? Who is saying GIP?
Intestinal hormone.
GIP. Anybody who is answering? So the correct answer actually is GIP, gastric inhibitory peptide was the answer. I think somebody said it. So that is the correct answer, but unfortunately will not be able to give the marks to Prince and Osama in this round. So this was the round one where we tried to keep questions from basic sciences. In the round two, before we go to the round two, I can ask the scorers, Ms. Kanika, and I'd like to thank them also for keeping the time and the score for this quiz. So Ms. Kanika, what is the score so far?
So team A, Dr. Prashanti and Bhavika lead with the 10. And C team, Dr. Vijay and Dr. M. Megha, 10. And rest are not open their account actually.
That's okay. So what we'll do is now we'll go to the round number 2. Again, this round will be slightly longer. We will have two rotations in this round. Each question will get you 10 marks. There will be no negative marking. First rotation will happen clockwise. Second rotation will happen anti-clockwise. I will tell you how it goes, but पहले राउंड में मैं A से शुरू करूंगा, दूसरे में मैं F से शुरू करूंगा इसके अंदर. So पहले मैं A से शुरू करूंगा अभी. I will request Prashasti and Bhavika from Kyrgyzstan to put on your cameras. क्योंकि जैसे when we start MBBS, we start from basic sciences. Then we start from anatomy, physiology, biochemistry. That was the theme of the first round. While in the second round, we'll go with the paraclinicals, like more like pathology, pharma, and your microbiology kind of questions, where we will have more, we will be making a bridge between the basic sciences and the clinicals. So, are you ready, beta, for your question?
Yes.
Okay, ready? Okay. So, I'll show you the question and I'll ask you the diagnosis. Ready? Okay, let's so. The question is this. A 20-year-old boy has fever for 2 months, gum bleeding, petechiae, gets bruises easily, peripheral smear shows mastocytosis, reticulocyte count is 0.5%, bone marrow biopsy shows fatty marrow, no blasts, no megakaryocytes. The image is shown to you of the bone marrow biopsy. You need to tell us the diagnosis. उसको बुखार है, gum bleeding है, petechiae है, bruises हो रहे हैं, रेटिकुलोसाइट काउंट भी बताया हुआ है, मैक्रोसाइटोसिस है, बोन मैरो में फैटी मैरो है, कोई ब्लास्ट नहीं है, कोई मेगाकैरियोसाइट्स नहीं है, डायग्नोसिस पूछा है.
Yes, sir. His platelet is also less and blasts are also absent. Bone marrow biopsy is also fatty infiltrate are there.
Yes.
Time up, sir.
Yes. What is your final answer, beta?
Sir, megaloblastemia.
No, sir.
So Prashasti, what do you want to say? Just discuss and give me the final and then say lock.
Yes, what do you think?
We plastic anemia because peripheral smear is not given.
So what is your final answer, beta? What is your final answer? What did you say?
Sir, aplastic anemia, sir.
She's saying aplastic anemia, and she's absolutely correct. Bhavika, you were causing problem, but Prashasti handled it in the end well, and the correct answer is aplastic anemia. Well done, beta. Very proud of you. Now I'll request you to switch off your cameras, and I'll request the team B from Philippines, Samriddhi and Mabul to put on the cameras. Ready, beta? Are you ready for your question from paraclinicals? Okay, here's your question. A wrestler presented with itch in the axilla. Organism produced velvety colonies with underside red color pigment in the culture. Microscopy shows pencil-shaped macroconidia and abundant microconidia. What is the diagnosis? Okay. इच इन दी एक्सिला ऑर्गेनिज्म का वेलवेटी कॉलोनी है, अंडर साइड पे रेड कलर पिगमेंट है, माइक्रोस्कोपी में पेंसिल शिफ्ट मैक्रोकोनिडिया है और माइक्रोकोनिडिया अबंडेंट है. Any answers, beta? I will request the people who are watching on the YouTube to keep firing your answers, and all the other participants also start getting ready. There will be some audience prizes which I will declare at the end of the quiz.
Sir, trichophyton.
So what is your answer?
Trichophyton.
Trichophyton?
Yes, sir.
And can you give us the full name? Trichophyton is correct, but can you give us the full name? Trichophyton. Okay, we'll give you plus 10 marks. We'll give you plus 10 marks. The correct answer is Trichophyton rubrum, where we can see the pencil-shaped macroconidia and abundant microconidia in the image. So full 10 marks to you, beta, on the right track, but try to give us the full answer in the next question. Now, question number 3 for the team C from Russia, Vijit and Megha. Are you ready?
Yes, sir.
Yes, sir.
Be on your marks. The question is very straightforward. So you can see one question was on pathology, second on micro, third will be on, obviously, on pharmacology. Let's try. And the question is, lady was stung by many bees. She developed breathing difficulty, hypotension. Which drug will be useful for this condition? Most useful. You need to name the drug immediately.
Tension.
There is an emergency condition happening here. Bee stung, breathing, cannot breathe, BP is falling. What do you do?
Adrenaline, sir.
They are saying the answer is adrenaline, and they are absolutely correct. Full 10 marks. Well done. We need, because of that bees anaphylactic shock is happening, adrenaline is the correct answer. So now I request team from Ukraine, Priyanka and Hitesh, to put on their camera. Are you ready to answer the question? Yes? Okay. All set. This 28-year-old lady admitted with fever, nausea, anorexia for last 2 months. HBS antigen is positive, anti-HBC IgM positive, anti-hepatitis C virus negative, HBC IgM is positive. What is your diagnosis?
Acute hepatitis B.
Hitesh is very fast in responding. He's saying acute hepatitis B. Priyanka, do you agree?
Yes, sir.
And both of them are totally agreed on it. And the correct answer is acute hepatitis B. Well done. You get full 10 marks. Well done, beta. Super proud. Now the question for team from Armenia and Kazakhstan, Dr. Nandini and Dr. Bhavna. Are you said to Nandini? Dr. Bhavna is not there, I think. Dr. Bhavna, can you put on your camera? Yes, beta. Sir. And here is your direct question. A couple is trying to have a child for last 2 years. After multiple unsuccessful trials, they went for respective examination. Female examination investigation was totally normal, but male had gynecomastia, small testes, scanty pubic hair. He also has history of antisocial behavior during the school days. What condition do you think he has? Antisocial behavior, gynecomastia, small testes, scanty pubic hairs.
History of antisocial behavior.
Are you ready to answer? It's a very simple question. Once you get the answer, you will know it.
Time up, sir.
So any answer you want to give? Anything you want. There's no negative marking. It is just like your FMGE exam, no negative marking. Yes, beta.
Maybe this is Klinefelter syndrome, sir.
Okay. So I think somebody in the team is answering. Anybody in the audience, anybody who wants to answer, just put on your camera and answer so that you can get some credit for it. Almost every team is answering it. It is Klinefelter syndrome. So unfortunately, team E could not get any score on it. The answer was Klinefelter syndrome. Well done, all of you. Super proud of all of you. So the final question now for team 6 from the team is from the Kyrgyzstan, and Dr. Prince and Dr. Osama, can you put on your cameras? I will just show you the question. The question is this. A soldier presented with fever, myalgia, rash in the body, sparing the palm and the sole. 5 other soldiers in the troop were also having similar illness. There is history of exposure to body lice. What is the causative organism? Are you able to hear me? Yes. What is your answer, beta?
Yes,
what
sir.
organism is causing this? Fever, myalgia, rash, not affecting the palms and the sole. Other soldiers are also affected. It's history of lice, history to exposure to lice.
Pyrogen.
What is your final answer, beta? What is your final answer?
Gupta.
Time up, sir.
Yes, give us your final answer, beta. Give us your final answer.
Septicemic.
Coxilla. Coxilla.
A type of
Unfortunately, we will not be able to give it to you. Anybody else in the participants or the audience wants to give us an answer?
Yes,
Sir.
sir. Sir, Coxsackie, A16.
Maybe epidemic typhus.
So the correct answer that we have is Rickettsia prowazekii is the correct answer. Rickettsia prowazekii. But unfortunately, we cannot give any marks to the teams. So we will now have another round, and this time we will start from team F again. Okay, team F. आपसे शुरू करेंगे क्योंकि next 6 question they will go anti-clockwise. So आपके साथ शुरू करके फिर वापस जाएंगे. Okay. So Osama and Prince can keep their cameras on. Rest of the teams can switch off their cameras and mics. And anyone else who's listening to us today, the important thing, the most important thing in life is confidence. Confidence रखना है क्योंकि lot of times I meet students who think कि sir मेरा तैयारी पता नहीं है या नहीं है और उस कारण से they are tentative. But if you are confident, you will start participating in more activities, and when you participate, you learn. है ना? Confidence बहुत ज़्यादा important है. So Osama and Prince, are you fully confident? Yes. Okay. Here's your question.
Yes,
Here's
sir.
your question, beta.
Yes,
Here's
sir.
your question directly. A deep vein thrombosis patient was started on anticoagulant therapy.
DVT.
The next day, the patient presented with features of shown in the diagram below. Most likely drug implicated for the adverse effect is.
DVT.
This is the,
DVT.
you can see some bleeding happening in the foot and all, you can see it.
Yes, sir.
And anticoagulant therapy was going on. Which drug has caused all this?
The warfarin tox.
What is your answer, beta? Final
Heparin.
answer?
Gupta. Heparin, sir. Heparin.
Heparin. Heparin.
Heparin, sir. Final.
They are saying the final answer is heparin. Unfortunately, that is not correct. Any of the other team members who wants to just pitch in with the answer by putting on the camera?
Warfarin, sir.
Sir, warfarin.
Warfarin.
So everybody is saying warfarin, and the correct answer was warfarin, beta. So unfortunately, you got it wrong, and we could not give any scores to you. Now we go to team 5 from Dr. Nandini and Dr. Bhavna from Armenia and Kazakhstan. I request you to put on your cameras. Okay. So, are you ready, beta? I'll show you your question. This patient was diagnosed with a DNA gene repair gene defect. He's having mottled hyperpigmentation on the skin and high risk for development of skin cancer as per the physician. What is the likely enzyme deficiency in this patient? DNA repair का gene defect है, mottled hyperpigmentation है, skin cancer का risk ज़्यादा है. हमें जानना है which enzyme defect in this patient.
इसकी नहीं.
हाँ?
Anything you want to discuss among yourself, you can do it. Every time I'm asking question to other participants, it is appearing easy, but when it comes to your turn, the question becomes tough.
Time up, sir.
Time up. Okay. Any answers you want to say, or shall I pass it on to other people for just for the academic purpose? So there's no score here. Anybody who wants to answer?
Xeroderma pigmentation, sir.
We need to know the enzyme defect. Enzyme defect. Not the condition. We need to know.
or ASP.
So the enzyme defect here is nucleotide excision defect, nucleotide excision repair defect. So that is the enzyme deficiency here, and that is caused the this is the DNA repair defect causing the condition. So I'll now ask the team C from Russia, Vijit and Megha, to put on their cameras, and I will give you a direct question here. This patient presented to hospital with road traffic accident. He has raised intracranial pressure, but there is no intracranial hematoma. Which drug is preferred for management of this patient with raised ICT? With what drug will you use? Yes, team C. What is your final answer, beta?
Sir, diuretics or mannitol diuretic.
Diuretic is a group. I just need to know the name of the drug.
Thiazide.
What is your correct answer? Give only one answer. You have given so many answers. Just say one answer. Okay, Megha will say. Let Megha speak.
Okay.
Let her give the final answer. Yes, beta, final.
Mannitol, sir.
She is saying mannitol, and it is absolutely correct. Well done, full 10 marks. So that is why I gave it to her, because I knew that she was going on the right track. Vijit was confusing her, but Megha did not allow herself to get confused, and she got the correct answer. It is mannitol. Well done. So now the question will be from team from Philippines with Samruddhi and Mehbul to put on their cameras. And Samruddhi, unmute yourself also. And this time I want to hear some answer from you. Are you ready, beta? This is a question for you. Patient with fever, headache, vomiting, altered sensorium, neck rigidity. CSF analysis shows slight decrease in glucose, increase in proteins. Microscopy shows predominantly lymphocytes. A coagulum of CSF is shown in the image. What is your correct diagnosis?
Sir, tubercular meningitis.
So Mehbul says tubercular meningitis. Samruddhi, do you agree? Okay, finally you say you agree. So computer ji, answer bataye. And the correct answer is tubercular meningitis. Well done, you get full 10 marks. Well done, beta, well done. So TB is one of the very common questions which is very often asked in your FMGE exam because it's very common disease in India. So very important clue were the lymphocytes, the CSF picture as well as the cognitive
White-
information.
white
that
Scott
you can
Google.
see. Well done, beta. Full 10 marks. Okay. And the final question of this round is for team from Kyrgyzstan, Prashasti and Bhavika. If you can put on your camera, Samriddhi, if you can switch off your camera. Okay. So this is the question for you. Are you ready?
Yes, sir.
A woman used aspirin, give me just one second, for arthritis for pain relief for years. Later, she developed intestinal bleed due to inhibition of dash. Are you able to get the question? A woman used aspirin for arthritis. She developed intestinal bleed, which occurs due to inhibition of dash.
Aspirin COX inhibitor, na Bhavika?
Inhibitors, yes.
What is the final answer that you
Cox.
want to give?
Later, she has intestinal bleeding.
So, Prashasti, I think COX inhibitors. What do you say?
So COX enzyme inhibition. What it is?
Time up, sir.
Okay, so that is not the answer that we have. Anybody else wants to give an answer?
TXA2, TMF,
Okay,
thromboxane
so-
A2.
Thromboxane
Yeah.
A2, sir.
Okay, so the correct answer is Vineet and Mega are correct, but we cannot give you extra marks, but you're correct. The correct answer was thromboxane. So the answer that we will give you thromboxane inhibition. So are we done with all the teams or did I miss
No,
out
sir.
on
One
anything?
D team question is pending.
And a D team question is
हाँ,
pending.
बीच
So
में
D
रह-
team, I think I missed out on our team in between.
Yes, yes.
So that's why I have extra question also. So team D from Ukraine, Priyanka and Hitesh, can you put on your cameras now? Ready? Okay.
Yes, sir.
Your question for you for this round is coming up on your screen now. There is a blood spill in the operation theater. Choose the correct agent used to clean the blood spill.
Sodium hypochlorite.
So good that I missed out on at that time. The correct answer, you have absolutely right.
Yes.
You get full 10 marks. The correct answer is sodium hypochlorite. Well done. Super proud of you, beta. Super proud. Okay. So we come to the end of this round. And before we start the next round, I'll request Kanika and Rakesh to give us the score so far. Which team is leading?
Sir, team C by 30.
Team C is at 30 marks. We give them a round of applause.
Then team A, 20. Team B, 20.
Okay, they are at tie.
Yes. And team D is also on the tie. So that also 20.
Okay. And
Yeah. And team E and F not having the number right now.
Okay, great. So at the end of this round, we know that it is not an easy quiz. It is still very closely fought. कोई भी जीत सकता है इसके अंदर. So what I'll do is we have with us, I think Dr. Shrish as well, or in the chat, I think he's not there. Okay. Let's see. So Kanika, if you are able to tell us the prizes for this quiz, just tell us also after the next round, if you don't have them right now, maybe. Any prizes? Are you
Sure,
aware of
sir.
it?
I'll tell you. The first prize is for rupees 30,000.
So it's a very high value quiz. If you win, you get 30,000 rupees.
And for
Yes.
the second round, 15,000. And for the third, 10,000 rupees.
Okay. I think many students will wake up now. Okay, now let's participate. It's a big value quiz. Are you ready for the round number 3? Okay. For round number 3, we'll start from the team A again. And our goal will be this time we will have a round which will be more clinical. Okay, so first round was more about basic sciences. Second round was more about paraclinicals. This round will be more about clinicals. Team A from Kyrgyzstan, Prashasti and Bhavika, I will request you to put on your cameras. Are you ready? And let me put on the question. Okay, let's see. So this time you will have 3 rotations instead of 1 rotation. मतलब एक बार 6 क्वेश्चन होंगे, फिर 6 क्वेश्चन होंगे, फिर 6 क्वेश्चन होंगे. And we'll do clockwise and anti-clockwise. There's no negative marking. Plus 10 marks can be achieved in this quiz. Okay, ready? All set? Let me get the question now. Okay. A 37-year-old unmarried female whose mother had breast cancer at the age of 50 years, sister had cancer at the age of 40 years, comes for regular checkup. She is sexually active, taking OPs for contraception. What advice will you give as the next step? Mother को भी breast cancer है, sister को भी breast cancer था, अभी आपके पास है. What do you think that you want to do?
Sir, we will advise her for follow-up for like genetic mutation studies.
Can you be more
And-
specific? Like किस प्रकार का
and-
genetic mutation सोच रहे हैं आप?
Sir, BRCA1 and BRCA2.
Okay, and I think we can give it to her. Well done. We'll have to advise her for genetic counseling for BRCA testing. Well done. And I think I'm super proud that you are on a roll and you got the answer absolutely right. Plus 10 marks. Well done. Okay. Next question for Team B from Philippines. Samruddhi Gaikwad and Mehbul Haq. Are you better there? Okay.
Yes,
So you can see already the quiz is warming up. Let me just put on the question on the screen for you. You need to identify the instrument shown to you. Osama, can you just keep your camera off? Yes, beta. Very easy.
सर ऑप्शन होता तो मजा आता.
इसमें ऑप्शन नहीं मिलेगा कभी भी, ये मैं बता रहा हूँ. जैसे ही मैं बोलूंगा सारे बाकी सब बच्चे कूद पड़ेंगे बताने के लिए. How much time is left?
So now time up.
Beta, time up हो गया. And anything you want to say or shall I pass it on?
Sir, seagull is specular.
Okay, so we're just passing it to rest of the teams. Anybody wants to answer? Just
Cusco speculum, sir.
Valvo diagram.
So
Team F,
Nandini
Valvo
already said it.
diagram.
Cusco speculum, sir.
Speculum. Sir, Team
The
F.
correct answer is actually Cusco speculum. Nandini is on the roll. Well done, beta. Super proud of you, beta. Super duper proud. Well done. So what we'll do now is we will have now the question for Team C from Russia, Vijit and Megha. Vijit and Megha, can you answer your question now? Ready?
Yes,
Okay. The question for you directly on the screen is very easy. So be ready. Okay. Identify the image and the diagnosis. Something from his face hanging there. What could it be?
Breast palsy.
पूरा डोसेज मतलब आंखें भी सब नीचे का है, पूरा मसल्स नीचे है. कोई मसल का भी मतलब ये हो सकता है जो वहाँ से अटैच्ड हो. कौन से मतलब कुछ किसमें कपाल से हो सकता है जो कि पूरा ट्राइजेमिनल है ना, पूरा इधर पे जो देता है.
Yes, beta. Your final answer, beta, please.
Facial palsy, Bell's palsy, sir.
नहीं, तो कुछ ऐसा नहीं लग रहा, कुछ ट्यूमर जैसा नहीं लग रहा तेरे को, मतलब वैसे क्या नहीं.
Time up, sir.
Time's up, beta. Okay, so anybody else on the participants? You want to
F1,
answer?
sir. Facial hemangioma.
Just put on your camera also so that I can, see what you're trying to answer.
NF1, sir.
NF1. Hitesh,
Yes,
why
sir.
are you saying NF1?
Because here is facial flexiform, sir.
So correct, Hitesh, well done, beta. What we are looking for as the answer was plexiform neurofibroma, and it is associated with NF1. So well done, Hitesh. We are super proud of you. You're on the right direction. Okay, done. Okay, so we are going to now ask the team D from Ukraine, Priyanka and Hitesh, for their direct question now. Are you ready, beta?
Yes, sir.
दूसरे के क्वेश्चन हमेशा ज्यादा आसान होते हैं, बट क्या करें, है ना? Let's try. Okay, this 26-year-old, just give me 1 second, with RTA complicated with pelvic fracture is transfused blood. Within a few hours, he develops fever, oliguria, hypotension. His CVP is normal. There is bleeding from the site of the IV line and through Ryle's tube. What is the diagnosis? उसको pelvic fractures हो गए, blood transfuse किया, उसके बाद बुखार हो गया, oliguria हो गया, hypotension हो गया, CVP normal है, लेकिन bleeding हो रही है IV line से, Ryle's tube से. What is the most common thing that has happened?
Maybe sir, embolism.
Hmm?
Embolism.
You can discuss amongst yourself also. We have time.
Tell us, Priyanka, something about this case. Sir.
Time up, sir.
Okay, your time is up. Priyanka, you want to say anything or no? No. So unfortunately, we cannot give it to you. Anybody else from the participants or wants to answer and let us know.
Thrombophlebitis, sir.
और कुछ सोचो. Anybody else? What is very common
Sir,
thing?
RH incompatibility, maybe.
Okay, so we are on the right track. It's not just RH, it could be anything that has happened. It is a blood transfusion reaction that has happened actually. So the correct answer was blood transfusion reaction. That because you have a recent history of blood transfusion, that is the first thing you would think about here. So unfortunately, the team could not score here. So I will now ask Nandini and Bhavna from Armenia and SKMA Kazakhstan to put on their cameras so that we can ask you the direct question. Now it is slightly difficult. Here, give me just 1 second. And so I want your partner also to put on the camera. I think Bhavna is not there. She's there. Okay, it's a slightly tough question. I will show you the question. It will have a table. You have to see the table and tell us which column is correctly matched. And there is more than one column which is correctly matched. Chorionic villi sampling done at 9 to 10 weeks. Okay. Amniocentesis done at 15 to 20 weeks. AF for AFP. Fetal blood sampling. Fetoscopy visualization of fetus. Yes. Which columns are any of the row column which is correctly matched? You can mention it, and if it is correct, I'll give it to you.
Sir, fetoscopy, I think.
Hmm?
Yeah.
Sir, second new cases.
I think amniocentesis.
Okay, so I'm giving it to you. Both 2 and 4 are correct statements, and I think Bhavna said 4, you said 2. I'm giving it to you full 10 marks. Well done. Okay.
Thank you, sir.
Well done.
Sir, I
Super
think
proud.
maybe all these difficult questions who come to me.
Now this time I gave you direct question. But इससे आसान तो नहीं दूंगा ना. Fetoscopy is to look for fetus. बस बढ़िया भावना. Well done. And I know Dr. Bhavna was not even switching on the camera. कहती मैं जा रही हूँ वापस. कम से कम आ गया एक question तो हो गया. Okay. So now I'm giving it to Prince from team F and Osama. Prince and Osama, can you put on your cameras? We have a question for you. थोड़ा सा लंबा है लेकिन question आसान है. कोशिश करेंगे. ठीक है? Ready?
हटना दे सर. बहुत लंबा question.
Okay. A 9-year-old African American child is brought to the emergency room complaining of painful swellings of hand and feet as well as abdominal pain. Feverish भी है, tachycardia भी है, कोई infection की history नहीं है, icteric है, liver enlarged है. Which of the following choices? Which of the following will be the likely diagnosis? आपने diagnosis बताना है. African American है. Very important, painful swelling है, hand feet की abdominal pain है, fever है, tachycardia है, no history of any infection disease, he has icterus or liver enlarged. What could be the cause?
Attack of no. Hepatomegaly or Reply any hint है? Trypanosoma cruzi.
Time up, sir.
हाँ जी, क्या what answer do you want to give?
Trypanosoma cruzi, sir.
Trypanosoma cruzi is not correct. देखो Trypanosoma cruzi लैटिन अमेरिका में ज्यादा होते हैं, तो अफ्रीकन हम कह रहे हैं, अफ्रीकन अमेरिकन है ना, सोचो. Okay, the time is up now, but let us see if any other participant wants to give us an answer.
Sir, cavernous hemangioma.
Nandini, what do you want to say?
So EBV like Burkitt's lymphoma, sir.
और आसान वाला सोचें जिसमें जॉन्डिस भी हो रहा है लेकिन उसे टैकीकार्डिया भी है, हैंड फीट पेन है, ऐसा कुछ सोचो.
Sir, cirrhosis.
अच्छा चलो, I think we'll have to give you the correct answer. The correct answer was, anybody else? Sickle cell anemia. The correct answer was sickle cell anemia with vascular occlusion causing the pain and sickling and hemolysis. Everything was connected with the Afro-American origin also. So correct answer was sickle cell anemia. And at the end of this first rotation now, what I'll do is I will change the direction of rotation. अब I will ask the questions from team F, फिर वहां से उल्टा चलेंगे अब, ठीक है? So this again I will ask Osama and Prince to put on the camera for the direct question, है ना? And Osama, if you're around, just put on your camera. I think उसका Osama is not there. I think Prince उसका नेटवर्क टूट गया क्या? ऐसा है?
Yes, sir, maybe.
है ना?
Network is.
Just a network issue है, उनको बोला है वाईफाई कनेक्ट करने को.
हाँ, ऐसा करें क्या? मतलब will you be able to do it alone? Try करें.
Yes, sir. Nice.
अच्छा, he's back. Let me add him in the chat. है ना? मैंने उसे ऐड कर दिया. Just ask him to put on the camera. Osama, if you've joined us, please put on your camera. Okay, let's try. If he's there, he can put on the camera. Osama, if you're able to hear us, just put on the camera. Yes, and unmute yourself. Okay, and I'm showing you the question now. आपका question directly screen पे आने वाला है. Okay, I'm giving you another question. Don't worry. This young neonate born at home was having history of delayed cry after birth and poor feeding, seizures. His MRI shows the following abnormality. What is the likely diagnosis in this particular child? So I've removed the previous question. There was something missing in that image, but now can you tell me?
Subdural hematoma.
Okay, unfortunately it is not correct. So anybody else wants to answer? वो delayed cry था birth के बाद, that is very very important. और उसके बाद MRI पे कोई finding दिख रहा है. Now can you put it together?
Leukomalacia, sir.
Who is answering? Can you put on the camera, beta? Yes, Nandini, tell us.
I think it is leukomalacia, sir.
Yes, well done, beta. But can you tell us where it is present? Where is
Periventricular, sir. Periventricular.
Periventricular. So you can see on the MRI there is problem in the periventricular area because of the hypoxia that happened during birth. Now the child has developed periventricular leukomalacia, which is the correct answer. Well done, Nandini. Super proud of you, beta. Super proud. Well done. You are on a roll. Okay. Now the next question is for team. Now for team 5 from Dr. Nandini and Bhavna. You can take a direct question now. Can you put on your cameras, beta? Yes, all set, and we are now going to show you your direct question. Dr. Bhavna is already smiling because she thinks you will get an easy question. Let's see now. But the question looks very tough. Oh my God. Okay. This 8-year-old child suffering from recurrent attacks of polyuria since childhood. Presents to OPD. On examination, he has short stature, normal vitals, normal BP, serum creatinine 6, bicarb 16, sodium 134, potassium 4.2, and ultrasound shows bilateral small kidneys. What is the diagnosis? Polyuria था पहले, short stature है, serum creatinine बढ़ा हुआ है, bicarb है 16, sodium, potassium बताया हुआ है, ultrasound में small kidneys है. 8-year-old child.
Nandini, you have any idea?
Sir, Bhavna, I'm thinking this nephrotic syndrome. What do you think? You have an idea about it?
I can't hear properly.
I think it is nephrotic syndrome. You can think in that way. You have an idea about it?
Sunshine.
नेफ्रोटिक में नंदी, do you think प्रोटीन नहीं होगा यूरिन में? ऐसा प्रोटीन यूरिया है नहीं, कुछ ऐसा और सोचें तो? Think something else. You have time.
Attacks of polyuria.
Time up, sir.
Sir,
Sir,
I think
is that
kidney atrophy.
Any final answer?
Bartter, sir. Bartter syndrome.
So the correct answer that we have is, anybody else in the participants wants to give us an answer? This is not the correct answer, but anybody wants to give us an answer?
Facial abnormalities.
Nephrophthisis, sir, maybe.
I think we need Megha on the correct. That is the correct answer. Juvenile nephrophthisis, and that is the correct answer. So we cannot give it to the team that was participating. So now I will ask the next team of from Ukraine, Priyanka and Hitesh, to put on the cameras. Are you ready, beta, for your direct question? Okay. Yes. The question is, the given instrument is shown to you. You just need to tell us, where do we use this instrument? In which kind of procedure do we use this instrument? Do you want a clue? We don't use it in the eye. It is a little larger than that. Not in ophtha.
Maybe this for in thyroid surgery.
Is that your final answer?
Yes, sir.
Priyanka, anything you want to add, or shall I give you the answer? Okay, so this is not correct. So let me ask the other participants to answer.
Sir, for abdominal surgery.
Retractor, sir. Retractor.
Doyen and even retractor.
So this is mainly
Sir,
used
Doyen
for,
and even retractor, sir.
Retractor, sir. Yeah, Mori retractor.
so
Sir,
this is
used
used
for
for
C-section, sir.
cesarean section. Yes,
C-section.
Prashasti is right. This is used for the cesarean section. Well done, Prashasti. Well done. You answered it correctly. Super proud of you, beta. Super proud. Okay. Well done. So now I will ask the question directly to team C of Vijit and Megha. Just put on your cameras. I will show you the question directly on the screen now. A 2-year-old child was diagnosed as having Kawasaki disease, was given IVIG in the dose of 2 gram per kilogram. 36 hours later, child continues to be febrile, has significant conjunctival and mucosal erythema. What is it that you need to do next? Kawasaki disease है, IVIG दिया, 36 घंटे के बाद भी अभी भी फिब्राइल है और significant conjunctival और mucosal erythema है. हाँ जी.
So can we start with steroids?
Yeah, beta, what is your answer?
Sir, maybe steroids with like prednisolone, maybe.
Yes,
Time up, sir.
Steroids, prednisolone, which is not correct. Anybody else from the rest of the teams wants to answer?
Sir,
Sir,
we can use infliximab, like MAO inhibitor, like infliximab.
Sir, antibiotic.
Okay.
Or
Okay, it's not correct. So correct answer is actually we need to give a repeat dose of IVIG.
repeat dose of
Repeat dose of IVIG was the correct answer. But unfortunately at that time, none of the team could answer. So I now ask Samruddhi and Mehbul Haq from Philippines, team B, to put on their cameras. so that I can ask you the next question. This looks a little easy. Let's see if you can answer. Are you ready? Let's get me uploaded for you. Are you ready?
Yes, sir.
Okay. This woman has pain, swelling, redness of knee joint and hand with morning stiffness, problem in squatting. Swelling is sparing the DIP joint. Image is shown to you. Which is the most likely diagnosis? Very easy. Yes, beta.
Sir, rheumatoid arthritis.
He's saying it is rheumatoid arthritis and he is absolutely correct. Full 10 marks. This is the true correct easy question where you can see the hand image. Anytime in arthritis, they show you both the hands. Start thinking rheumatoid and it involves the MCP and PIP. Here we saw the DIP was spared, which is correct. Well done, beta. You get full 10 marks.
Thank you, sir.
And the question now for the team from Kyrgyzstan with Prashasti and Bhavika. A direct question will come to you. It is of moderate difficulty level. So Bhavika, if you can switch on your camera as well. Okay, are you ready? There is your question. A patient, a 60-year-old patient presented with renal failure develops vomiting, restless in ICU. ABG analysis shows sodium 145, chloride 100, bicarb 24, PCO2 40, pH 7.4. What is the most likely metabolic abnormality?
Prasasti, what do you think?
Yes.
It's first of all the respiratory and the rest.
First, pH in normal range.
Yes, pH is normal, bicarbonate is normal.
PCO2 is what is the normal value for PCO2?
I think 35 to 40. I think it's
40.
normal. pH is normal. Sodium
PCO2
then
is also
yes. So bicarbonate is normal.
up,
So it's
sir.
not. It already shows meta.
I think normal
Time
because pH and bicarbonate all are normal in normal range.
So what is your final answer, beta?
Sir, respiratory acidosis. Metabolic acidosis.
Okay. Anybody? Okay. What kind of metabolic acidosis do you want to say? There is something specific that we are looking for as an answer in this question.
So we can calculate anion gap of 140, 145 minus.
Now, do you want to
Right.
give an answer?
High anion gap.
Perfect. And she's absolutely right. I think they deserve a round of applause because they did a good job, as the answer is high anion gap metabolic acidosis. Well done. They played as a team and they pitched in with the correct building blocks. Well done, beta. Full 10 marks. Okay. Now the question, we will have another question now for, I think, for the same team. I think now we can go in this direction. So team A, you will get a direct question now for you. Team A of Prashasti and Bhavika, if you can put on your cameras, so that I can ask you a direct question. Okay, ready?
Yeah.
Okay, the question is this. You need to identify the image shown to you.
Sir, by dot spots.
Yes, sir.
By dot spots.
Okay, and I think it is correct. I think it's correct. Just give me 1 second. It's absolutely correct. You get plus 10 marks. Well done. Well done. Okay. So you get plus 10 marks. I just, there is some slide issue here. Just give me 1 second. Okay. So you are absolutely right. And I'll ask the next team from Philippines, Dr. Samruddhi Gaikwad and Mehbul Haq to be there. Okay. Are you ready, beta, for your direct question? Let me just, next question. Okay. This patient has, give me just 1 second. There is some issue.
Sir, option B.
I think A.
What is your final answer? What is your final answer?
Sir, B.
Absolutely right. I think we can give it to you full 10 marks, Vita. Full 10 marks. Well done. So B is the, I think it is the problem in the Broca's area. Unfortunately, my computer, the image is not opening, but it is correct. Well done. Okay.
Thank you, sir.
Okay. So now the direct question from for team from Russia, Vijit and Megha. Let's see if you can answer the direct. I will show you the question. The question is this. Which of the following blood vessels does not take part in the anastomosis in the area circled in the image in red in the nasal septum?
So the vessel does not take part in the anastomosis. कौन सा सेप्टम है? रेड ऑफ द नेजल सेप्टम ये है ना, ये एरिया बोल रहे हैं जो रेड में
उसमें नहीं करा
नहीं, ये जो बोल दे
सर posterior ethmoidal artery.
They are saying posterior ethmoidal artery and it is absolutely correct. You get full 10 marks. Well done, beta. It is a posterior ethmoidal artery. And now we have a question for Priyanka Thakur and Hitesh from Ukraine. And let's see if the question I have is there or not. Let's see. Okay. So the question is this. Are you ready?
Yes, sir.
A 19-year-old girl with neck swelling, which moves with deglutition, invading the surrounding structures. What is the probable diagnosis based on the slide shown to you?
Is it papillary thyroid? Hitesh, is it papillary thyroid?
Maybe.
Is that your final answer?
Yes, sir. Final answer is papillary thyroid.
Anybody else in the participants wants to give a try?
Sir, orphan I have
Glossal cyst, sir.
Thyroglossus, sir.
But it is invading the surrounding structures. Just
Sir, orphan I any nuclear.
Thyroid cancer, papillary thyroid carcinoma.
I think we can give it to you for the people who are saying papillary cancer thyroid, but
Suspensory ligament of Berry, sir.
okay, I think we will give it to the team. They were participating, and the answer that we have is thyroid cancer actually. So we'll give it to the papillary thyroid. This is your question. This child came to you with a dome-shaped pearly lesion on the forehead. Mother also has similar lesion. Likely diagnosis is?
Bhavna, I think it is molluscum contagious. What do you think? Bhavna?
Yeah.
I think it is molluscum contagious. You have an idea about it?
And she is on the right track, and we give full 10 marks to you. Well done. It is molluscum contagious mpox virus. Well done. We give you full 10 marks. Okay. And now we have a team left, but the questions are over. So what I'll do is for the next team of team F, Kyrgyzstan, Prince and Osama, if you can put on a camera, I will directly ask you a question and you can just hear me and answer.
Yes,
are you ready?
Yes,
Okay.
sir.
A patient develops infarct in the thalamus. Okay. Which artery is supplying the thalamus in the brain? Is it there are three main arteries in the brain. So which of those three arteries is supplying the thalamus?
Subclavian artery. Thalamus. in thalamus, which artery supply in thalamus. Subthalamic.
So I want to know between, is it anterior cerebral artery, middle cerebral artery, posterior cerebral artery, vertebral artery, pons, or the basilar artery? Like which of the main vessels supplies the your
The posterior cerebral artery. The final answer.
Final answer.
Cerebral artery.
So they are saying
Yes,
posterior
posterior.
cerebral artery. It is absolutely right. Full 10 marks. Thalamus is supplied by PCA. Well done, beta. Well done.
Yes.
So at the end of this round, which will have some more energy. So Kanika, what is the final score so far?
Sir, team A, Dr. Prashasti and Dr. Bhavika leading with 50. And then Dr. Samruddhi and Dr. Mahabul, team B is 40. Team C, Dr. Vijit and Dr. M. Megha, 40. Then team D, Dr. Priyanka, Dr. Hitesh, 30.
Okay.
And team E, Dr. Nandini and Dr. Bhavina, 20. And team F, the Prince and Dr. Osama, 10.
Okay. Okay, everyone. So welcome back. We'll now start the final round, and we have tried to keep this round as a make or break round. It will be a visual round. I will show you some images, and at the end of the image, one person from each team can remain on the screen. So from team A, I think who is going to be on the screen from team A? Prashasti or Bhavika. One person can remain on the screen, and so that we can do a buzzer kind of thing. If you press the buzzer, or you have to say your name, like suppose you want to answer, you will have to say team A, like suppose. So anybody who speaks first will get a chance to answer. Okay? So one person from each team can remain on the screen. It will be a buzzer round. आपको अपना नाम बोलना पड़ेगा. जैसे आपने बोला, जैसे मैं क्वेश्चन खत्म करूंगा, मैं बोलूंगा नाउ. आपने बोला टीम A. So we will see who has raised their hand and said A first. उसको हम मौका देंगे आंसर करने का. If you answer correctly, you get +10. If you answer wrong, you get -5. Okay, ready? Ready? So team A से कौन रहेगा स्क्रीन पे? I think Prashasti, are you there? Okay.
Yes,
team
sir.
B से I think Mehbul Haq will remain on the screen. Yes. Team C से Vijit and Mega both can be on the screen. I think वो तो एक ही विंडो में ही है. Team B and team D. We can have Priyanka and Hitesh में से कोई एक जना स्क्रीन पे रह सकता है. हितेश है. और team E नंदनी and team F से प्रिंस और ओसामा में से कौन है स्क्रीन पे? ओसामा. ओके, ठीक है. तो अब सिर्फ हम बजर की तरह करेंगे सो दैट टाइम कम लगे, और जैसे ही आपको आंसर लगे आपने बोलना है. ठीक है. मैं एक बार स्क्रीन शेयर करूंगा, एक बार वेट करेंगे हम लोग. आप लोग स्क्रीन देख पा रहे हैं?
Yes, sir.
Okay, just let me also optimize my own screen also so that I can see all of you. कनिका, आप सबको देख पा रहे हैं? आपने बड़ा कर दिया स्क्रीन को अपना?
सर नहीं, एक सेकंड
है ना, वो देखना, कोई बच्चे ना मुझे भी दिख नहीं रहे थे, आप देख रहे हैं. Okay, are you ready now?
Sir.
Okay, I'll just show you the image just. So +10 if you are answering it correct. Incorrect बताएंगे तो -5. Are you ready? Okay. Okay, the first question on the screen for you now. +10 -5. ठीक है. The structure pointed develops from which pharyngeal arch?
Sir, team A.
team A.
Team A has answered.
Sir,
Yes, Prashasti, tell us.
Sir, first pharyngeal arch, sir.
She's saying first arch. Absolutely correct. +10 marks. Well done. Okay. Ready now, everybody? So unmute yourself, everybody. Unmute yourself so that you can shout immediately. Okay. Ready? Okay. I am going to show you an anatomy question now. The following, which of the following will be seen in case of compression of the marked structure? Okay, marked structure is a nerve. You want to try? Okay. So no marks now for anybody. Anybody who wants to try now?
Allah, sir.
Allah, sir. Team F, Allah.
Clubbing, sir.
Okay, no, actually it was The median nerve. So and the answer is the ape thumb deformity that we had. Okay. So next direct visual question for you. Okay, ready? This 45-year-old laborer presents with vesicles and bullae in the light exposed area. These lesions leave scar. He is an alcoholic. He has no abdominal pain, no loose stools. His mental status is normal. What is the diagnosis?
Psoriasis.
Hitesh, Dr. Hitesh.
Hitesh, -5. Okay. Okay. Anybody else now wants to try without marks or with marks? Okay, with marks. One more try. Okay, no marks now. Anybody wants to try now? Free.
Is it niacin deficiency?
No. Anybody else? Okay, so the correct answer that we have is the Porphyria cutaneous tarda. Okay, next question. Okay, next question. Let's see if you can see the question. You need to identify the maneuver depicted in the image.
B.
Team A.
Group B.
Team A, sir.
Team B was the one which
Team B.
Yes.
Team
Yes.
A.
Team B.
Team B. Pringles maneuver, sir.
He is saying Pringles maneuver, absolutely correct. Plus 10 marks to Team B.
Pringles maneuver.
Okay, next image. I'm showing you the next image. Everybody get ready now. Get ready. The picture given below is the father of gynecology. You need to identify the personality.
Gynecomastic.
Anybody wants to try?
Team C, sir.
Team C, yes.
Dr. Vijay.
Marian, sir.
Marion.
Yes, sir.
Absolutely correct. He is Marion Sims. Well done. Plus 10 marks to Vijit and Megha from Team C. Well done. Okay. Okay, next question. Ready? Make the diagnosis based on the image shown to you.
Sir, Team B.
Imperfecta, sir. Team F.
Team B, yes.
Achondroplasia, sir.
What did you see on the image?
Achondroplasia.
Champagne glass. Well done. It is achondroplasia. Plus 10 marks. Well done. Plus 10 marks to Team B. Mehbul Haq. Well done, beta. Well done.
You,
now,
sir.
Team B is all rounding, increasing the difficulty now. Now, let's see. Okay. Next question. Identify the D in the image. D for donkey. D for doctor. D.
Team C, sir.
Team A, sir.
Team A.
sir.
Team C was the first one. Yes.
Corpus callosum, sir.
Team D, I think. No? Team D was the one which said, or Team C?
Team C, sir.
Team C, sir.
Team C. Okay, Team C. Corpus callosum is absolutely correct. Plus 10 marks. Well done. 10 marks. Vijit and Mega, 10 marks. Okay. This patient has recurrent abdominal crampy pains. Barium is shown to you. Just need to see the diagnosis.
Team F, sir. Out to the appearance.
Wait. I think Nandini was the one who raised the hand first.
Dr. Nandini is there.
Yes, Nandini.
Ulcerative colitis, sir.
Nandini is saying ulcerative colitis and she is absolutely correct. Absolutely correct. So, Team E, Team 5 gets plus 10 marks. Well done. Okay. I will show you another image. Okay, everybody get ready. Identify the structure marked as 6.
Team C, sir.
Team A, sir. Team A.
I think Team C. Yes, Vijit and Megha.
Coracoacromial, sir. Coracoacromial ligament, sir.
They are saying coracoacromial ligament, which is absolutely correct. Plus 10 marks. 10 marks. Well done. Very good. Okay, ready? Everybody on your marks. Get set. In which condition?
Team B. Diffuse esophageal.
Team B. Okay, Team B.
Diffuse esophageal.
Team A,
Team
sir.
F.
What is the answer, Team B?
Sir, diffuse esophageal spasm.
Diffuse esophageal.
This is the classic appearance of corkscrew. Well done, beta. Correct.
The Team B will get the marks.
Team B gets 10 marks. Other teams get 5 marks. No marks to anybody. Okay. Okay.
All correct,
everybody,
sir.
are you ready?
Yes, sir.
Okay. Identify the famous specialty often called as the father of modern pathology.
Modern pathology.
Which team?
Team C.
Team C, sir.
Team D.
Team D, sir.
Team C.
Team D, sir.
I think Team C has
D, sir, D.
said pass. Team C, what is that?
C.
D, sir.
Team F, sir.
D, sir.
Team C, sir. Team C, sir.
Okay.
Dr.
Who is
Vijay.
answering now? Who is answering?
Team D.
Team C. Kanika, tell us who is answering?
Team C.
Team F.
Okay, Team C, your answer. Team C.
Sir.
Rudolph Vacho, sir.
Correct answer. It is Rudolph Volstow. Team C from Vijit and Megha get 10 marks. Well done. Okay.
Sir, we are not getting chance, sir.
Okay, now I will give you chance. Don't worry.
Sir, we'll do one thing. एक बार म्यूट
2-3
करने हैं
times I missed.
जो एकदम वो अनम्यूट करे.
Sir, we are saying, but
Okay, all are saying all the things.
Yes, sir. 2-3 question are almost.
Okay, okay.
yes, sir. It's like that.
Okay. Are you ready now?
Yes, sir.
Correlate the two images and give the diagnosis.
Sir, Team B.
Team B. B.
Team B. No, Team B.
Team D, sir.
Sir,
Team B was
B.
the
B.
one.
B. हाँ.
D, sir. Team D.
Sir, neurofibromatosis.
Team D, sir.
He is saying neurofibromatosis type 2. Mehbul Haq.
Yes, sir.
-5. Yes, other teams. Chandni, yes.
Sir, neurofibromatosis 1, sir.
-5. Anybody else who wants to tell?
Sternberger syndrome, sir.
Trudge Weber, -5.
No.
The only one is left now.
Sir, can I try once more?
But I'll take more 5 marks then. Okay. So anybody else? Now the final answer was tuberous sclerosis. You could see adenoma sebaceum and the typical cutaneous manifestation was shown to you. I think.
Sir, -5 is of Team B only, na?
Okay, only one team will get -5, Team B. Others, we are not cutting any marks. Okay, ready? Okay. Let's see if I have any more questions left. There is a logo shown to you. Where is the headquarters?
Team F, sir.
Team D, sir.
Team D. Team D.
Team F, sir.
Okay. Now I want everybody to be silent, and when I will say that answer, okay, after that you can speak your team name. Okay, ready?
Yes.
Answer.
Team D.
F, sir.
Team D.
I think Priyanka, Team D, yes.
UNICEF.
Nee,
Where is its
headquarters?
headquarter located?
Geneva.
Geneva, sir. Geneva.
Geneva, sir.
-5, Priyanka, -5. It is New York. Okay, New York.
Oh, God.
Oh, okay. Okay, ready now. Wait. Okay, next round. I will say answer after that you can speak, okay? Don't speak before it. Okay? Wait, what has happened on this image? Answer.
Team D.
Yes, Team D, yes.
Bladder tuberculosis.
-5. Okay. I will now answer
Bladder
because
stone. Sorry, bladder stone.
okay, this is a cystogram where you can see dye has leaked from the bladder. That tells you that there is a bladder rupture actually. So dye is leaking from a bladder. This is a case of bladder rupture. So -5 to Team D. And the Hitesh is telling Priyanka ke इससे तो बोलती ही नहीं. बहुत 2 बार -5 करा दी. Okay. Let's, ready? Okay. This 25-year-old woman has.
Sir, Team E. Sir, Team E.
Wait. Let me show the question.
Team A, sir.
There are some lesions on the labia. Microscopic finding is shown to you. Answer now.
Team A.
Then the Dr. Nandini.
Dr. Nandini from Team E. Yes.
Syphilis, sir.
She is saying syphilis. She is absolutely correct. Plus 10 marks. Well done. Okay. Okay. So at the end of this round, I think we have seen a lot of action in this buzzer round. Lot of issues happening with the internet connection, etc. But don't worry, all of you played very well, and we are all very, very proud of you. So what we'll do now is I will ask the scorers to check the final scores once, and before we give you the winners of the quiz, I would again want you to share your experience of, please from the Team A first. I will request Prashasti and Bhavika to put on their cameras. and everybody else to switch off their cameras. And I will ask Prashasti and Bhavika that how are you feeling after the quiz now?
Great, sir. So much to learn.
Okay. And do you feel, before the quiz and when you come back, do you feel slightly more motivated?
Yes, sir.
Slightly more
There's
charged?
more motivated and also more accurate now, because now by this like face-to-face session, we get to know how to eliminate the common mistakes we used to make in exams. So that's the biggest positive point.
And
Yes,
second thing
sir.
is that when you participate, the first step is participation. If you participate, you start winning. Many people keep thinking कि यार हम quiz में जाएंगे, online खेलेंगे, हमें आता ही नहीं होगा, वो खेलते ही नहीं है फिर. And if you don't play, you will never win. जीतने का पहला कदम है कि मुझे कहीं खेलना शुरू करना पड़ेगा. And when you participate, you are winner. मैं ये बता रहा हूँ, and I want you, Prashasti and Bhavika, to promise me one thing. आज से आपने कैसे वाला बच्चा बनना है? बताओ कैसे वाला, जो जब भी क्लास में कोई पूछे कि कौन कौन क्विज में खेलेगा, आई वॉन्ट योर हैंड्स टू गो ऑन, है ना? कौन कौन, जब भी आपने देखा होगा ना कॉलेज में भी कभी बोलते कौन प्रेजेंटेशन करेगा, आई वॉन्ट यू टू से यस. आपका हाथ इमीडिएटली आप आ जाना चाहिए, मुझे पार्टिसिपेट करना है, बिकॉज व्हेन यू पार्टिसिपेट यू विन बिग. नाउ आई विल रिक्वेस्ट द टीम बी फ्रॉम फिलीपींस, समृद्धि एंड महबूल, टू पुट ऑन द कैमरा एंड रेस्ट ऑफ द टीम्स कैन स्विच ऑफ. हाँ महबूल, आई थिंक आखिरी राउंड में आपने काफी पिक कर गए. तो समृद्धि कैसा लग रहा है? महबूल कैसा लगा? हाउ वाज योर एक्सपीरियंस
अच्छा लगा
आफ्टर द क्विज?
बहुत ही अच्छा लगा.
थोड़ा एक्साइटमेंट लगा?
तो स्टार्टिंग में डर था एंड कुछ आंसर आ भी रहे थे बट बोल नहीं रही थी, लाइक लग रहा था राइट बट बोल नहीं पा रही थी.
सो बेटा शुरू में डर रहे थे क्या?
सर बहुत डर रहा था.
अच्छा समृद्धि, मैं ना आपको भी कहना चाहता हूँ, इट्स वेरी इंपॉर्टेंट कि अब जैसे पहले बच्चों को मैंने सिखाया ना कि हमें हाथ उठाने से हम गेम जीतना शुरू कर जाते हैं. देखो जैसे एक ना हम जब कॉलेज में पढ़ते थे तो एक बात किसी ने बताई, हो सकता है हंसी की बात हो लेकिन बहुत जरूरी है. किसी ने बताया कि यार कई लोग ना बहुत ही खूबसूरत लड़की उनको देखती है, वो कहते हैं यार अपना तो चांस ही नहीं है, बात ही नहीं करते. जो बात ही नहीं करते उनकी बात बनती ही नहीं कभी भी. बात बननी तो जाना तो पड़ेगा बात करने के लिए. वो पार्टिसिपेशन था, पहला पॉइंट था पार्टिसिपेशन. दूसरा पॉइंट है डर के आगे जीत है. ओके, सो व्हेन वी इफ यू आर अफ्रेड, हम हारना शुरू हो जाएंगे क्योंकि हम डर रहे हैं, जबकि क्वेश्चन होते मुश्किल नहीं होते. तो इफ वी स्टार्ट, मतलब अपने आप को मन से डर हटा दो. ये मत सोचो कि मैं किसी से कम हूं, अपने मन से डर हटा दो, आप अच्छा कर पाओगे. ओके, वेल डन बेटा. सो टीम सी, विजित एंड मेघा, कैन यू पुट ऑन योर कैमरास नाउ? हाँ बच्चे, व्हाट डिड यू लर्न फ्रॉम टुडेस क्विज?
सर इट्स आवर फर्स्ट टाइम, पहली बार था. थोड़ा पहले बहुत ज्यादा डर लग रहा था बट अभी अच्छा लग रहा है सर, थोड़ा कॉन्फिडेंस आ रहा है सर.
हर चीज का कभी ना कभी तो पहली बार होगा ना. तो अगर देखो, मैंने कई बार ये देखा, बहुत सारे लोग कहते हैं कि वो ना कि यार ये मुझे पहली बार है, मैंने पता नहीं कर पाऊंगा नहीं कर पाऊंगा, वो करते नहीं है. लेकिन हर बड़ी चीज का कभी ना कभी तो पहली बार होगा. जैसे लॉट ऑफ पीपल कम एंड आस्क मी, सर आप तो सर ऐसे बोल देते हो कि कुछ भी कर लो, मैं तो नया बिजनेस शुरू कर रहा हूँ, मैं कैसे करूँ? मैं कहता हूँ मैंने भी तो कभी पहली बार एक पहला डैम्स का सेंटर खोला होगा ना. वहां से जाके आज मैं पूरे इंडिया में मेरे सेंटर्स हैं, या मैं पूरे वर्ल्ड में मैं बात कर पा रहा हूँ, लेकिन कभी तो पहला मैंने भी किया होगा ना. सो फर्स्ट स्टेप सीम्स टफ, लेकिन करना तो पड़ेगा. ऐसा कुछ भी बड़ा सपना देखोगे, इट विल स्टार्ट विद स्मॉलर स्टेप्स. कुछ भी बड़ा सोचोगे, शुरू तो छोटा ही होगा ना. तो शुरू करना जरूरी है. एंड आई एम सो हैप्पी दैट यू कुड कम टुडे बेटा. बेस्ट ऑफ लक, प्राउड ऑफ यू.
थैंक यू सर.
एंड टीम डी, यूक्रेन, प्रियंका एंड हितेश. हाँ प्रियंका, क्या सीखा आपने आज? एंड हितेश?
बहुत कुछ सीखने को मिला, गलतियों का पता चला,
सिली मिस्टेक्स का भी पता चला, मुझे लगता है आपको नेगेटिव मार्किंग से.
हाँ जी.
So in a multiple choice question, it is important to, I'll give you the trick. How do we avoid silly mistakes? The trick is, do not overthink on a direct question. अगर कोई direct question है तो उसमें overthinking मत करो. Number 2, read the question carefully. जैसे लोगो दिखाया मैंने and you could identify, बट वो पूछा था जगह कहाँ की है तो आप फंस गए, आपने सोचा ही नहीं था, आपने बजर दबा दिया था तब तक, है ना. सो डो नॉट रीड इट प्रॉपरली, डोंट ओवर थिंक ऑन डायरेक्ट क्वेश्चंस, डोंट अंडर थिंक ऑन इनडायरेक्ट क्वेश्चंस. अंडर थिंक, अगर इनडायरेक्ट क्वेश्चन है थोड़ा सोच के करना चाहिए, नहीं तो गलत हो जाता है. अगर डायरेक्ट क्वेश्चन है, क्लास में पढ़ाया गया है, गो विद फर्स्ट इंस्टिंक्ट. ओके, एंड हाउ आर यू फीलिंग नाउ? स्लाइटली मोर कॉन्फिडेंट आफ्टर पार्टिसिपेटिंग?
यस सर.
थोड़ा पता चला कि बाकी जगह के बच्चे भी किस तरह से पढ़ रहे हैं और कैसे हमें अपना गेम में कैसे और इम्प्रूवमेंट कर सकते हैं.
Yes,
Well done,
sir.
beta. Super proud of you.
Thank you.
Okay, thank you, sir.
And I'll request now Nandini and Bhavna to put on the cameras. Dr. Nandini, one personal message that you're doing very well. I was so happy that you were answering so many things, Nandini. Well done. And Bhavna, can you put on your camera? Yes.
Yes, sir.
Yes, bachas. Both of you. How are you feeling now?
सर नाइस गुड सर पहले ऐसे लग रहा था कि क्योंकि पहला क्विज था और सारे सब्जेक्ट्स नहीं होते बट सर इट वाज नॉट अबाउट विनिंग एंड लूजिंग इट्स लर्निंग फॉर मेनी थिंग्स इट वाज अ नाइस एक्सपीरियंस बिल्ड अप कॉन्फिडेंस फॉर दिस
Perfect. Nandini, what do you want to say?
Even though I think I got many tricky questions, I didn't felt bad about it, sir. We have to answer even without choices. I learned that thing today, sir. And
I think two very
as
important
you always
things.
say,
Very
in
important.
it to win it, sir.
Yes, you are in it to win it, but two very important things.
Yes.
Learn to answer the question without choices. That is very important because in the real exam, when you see choices, you get confused. कभी-कभी आप लोगों ने ना, you might have seen some social media, Facebook or Instagram status of somebody saying complicated. कभी देखा किसी का status complicated हो? वो क्यों होता है? उसके बहुत सारी choices होती है ना, तो complicated हो जाती है जिंदगी. इसलिए choices देख के ना आपको हमेशा complication लगेगा. Whenever you see choices, you get confused. But if you are in a habit of thinking the answer without choices, you will never be confused. Convert questions into fill in the blanks. You will always do better. Okay, it's a very good idea. And second thing is, don't get disheartened about any winning or losing. It's always a learning experience. Well done, beta. So happy that you could reach so far. And Prince and Osama, if you're there, beta.
Sir, we are feeling very great. Sir, आप हमेशा आइडियल हैं हमारे और DAMS so close to us, sir. और थोड़ा सर हम लोग बजर राउंड में भी हमारी शायद नेटवर्क की वजह से नहीं पहुंच पाई. 2-3-4 आंसर हमारे रह गए उसी में एक्चुअली सर.
कोई बात नहीं. कभी-कभी ना असली एग्जाम में भी ऐसा होता है, कभी-कभी कंप्यूटर थोड़ा खराब चल रहा हो, कभी कुछ हो सकता है. कोई बात नहीं.
जी सर.
आप पहले आए उसी से आप विनर ऑलरेडी हैं. डोंट वरी.
यस सर.
है ना?
नहीं सर. आपने मोटिवेट किया सर. Lord MBBS for 25 years.
Wish you all the best, beta. God bless you. And now I will ask Kanika and Rakesh to give us the final scores. And we also have Dr. Shrish Pandey if he's around. Shrish and Rahul, they were the people who worked very hard to do the preliminary round. And दोनों बच्चे अभी इस साल उन्होंने FMG exam भी पास किया. If you're around, can I ask you to put on the cameras? And जब तक I request Kanika to give us the scores.
Yes, sir. Dr. Team A, Dr. Prashanti and Dr. Bhavika Singh from Kazakhstan. They are third in this.
Which team is third? Team from
Team
Kyrgyzstan, Prashanti and Bhavika, please put on your camera. You are number 3 in this today's quiz. You get a cash prize of 10,000, which will be transferred to you soon, not on this video, but you will get it. Congratulations. And
Thank you.
which college are you from? Please tell your college name also once more so that the college people can also feel proud of you.
The Kyrgyzstan Academy.
Very good, beta.
Now Team B, Dr. Smudhi and Dr. Mahabul, they are second runner.
First runner-up team which has come second are Samriddhi Gaikwad and Mehbul Haq. Well done, beta. You are second. You get a prize of
15,000.
15,000 rupees. We are very proud of you. Congratulations.
Thank you, sir.
Well done, beta.
And the winner is Team C, Dr. Vijay and Dr. M. Megha.
So Vijay and Megha, well done. You are the winner. You get a prize of
Thank you, sir.
30,000.
30,000 rupees. Well done. And it is not only about the money, it is also about the prestige that you are the winners. This should give you a confidence that I can do much better than this. Well
Yes,
done,
sir.
beta.
Sir, I have a doubt.
Yes.
Sir, can you give any information about upcoming this June FMG?
So June FMG most likely will happen on time. Don't worry. It should happen in the second week of June. It is like a lot of people are saying कि अभी next होगा ऐसा अभी लगता नहीं इस अभी जून में आने के लिए. So most likely it will happen. So let's keep focused. And also I want to tell you that soon we will also be announcing at DAMS. We are doing 2 things for the June FMG exam. We will be announcing a very special revision course and very special tests which will be conducted in computer centers. So I will also announce it on my Instagram. It will come as a surprise tomorrow. So join us on the DAMS YouTube channel tomorrow. Okay.
Thank you, sir.
And I'll request now all the teams to put on the cameras. Put on the camera so that we can have the final photograph. I will request Kanika to take a screenshot. Everybody on the screen now? Anybody missing?
Yes, sir.
Ready? This photo will go on the Instagram, so please look your
So
best.
wait a minute.
Okay, you have to say
Now we start.
in it to win it, and then we'll make a V sign. Okay, ready?
Yes, sir.
In it
To win
win
it.
it. Okay, did we get it? Get it, or should we take one more?
So take one more.
I think Nandini, you were not smiling. One more, okay? Ready? Okay, well done. And you're looking the best and the awesome. After this snapshot goes on my Instagram, you will get many friend requests. And I also want to tell you, okay, the final message that I want to give to all of you and all the audience who are listening to me right now is, do not limit yourself with the labels that the world gives us. दुनिया हमें कई बार लेबल दे रही होती है. कोई बोलेगा कि यार तुम फॉरेन मेडिकल ग्रेजुएट हो, कोई बोलेगा यार किसी को कि तुम्हारी हाइट कम है, तुम्हारी हाइट ज्यादा है, तुम पतले हो, तुम मोटे हो, कोई ना कुछ कहता रहेगा. उन लेबल से अपने आप को लिमिट नहीं करना. Don't label yourself because of a label. ऐसा कुछ भी नहीं है. You have the same ability as anybody else to do as, go as high as possible. खाली FMGE exam नहीं है. I know of foreign medical graduates who are doing their post graduation in places like AIIMS also. And I know of FMGE graduates who are now well settled as senior doctors. पहुंच सकते हैं हर जगह तक. हारेंगे सिर्फ तभी अगर अपने आप को लेबल करके सीमित कर लिया कि मैं तो इतना ही कर सकता हूँ. Do not limit yourself by the labels that the world gives you. You are more powerful than that. You have more ability than that. I wish you all the best. It was a pleasure to conduct this quiz with all of you. Do connect with me on personally on Instagram as well. It will be a pleasure to connect to you after that also. I wish you all the best, beta. God bless you.
Thank you,
Thank you, sir.
Bye, bache. Bye.
Thank you, sir.
Big round of applause for all of you.
sir.
Well done, beta. Well done.